Welcome, Dr. Elia, to this conversation with Ubuntu Beds. My name is Kim Whitaker, and I am the founder of Ubuntu Beds, which is an initiative that unites healthcare workers with empty hotel beds and accommodations around South Africa. Thank you so much for joining me today.
Thank you. It's my pleasure to be here, and I love the organization and what you guys are doing. That's a great mission.
Thank you. So I'm going to introduce you briefly as the president of the Happiness Center, which is an organization of leading world experts in the field of positive psychology. And I read up a little bit about you, and I found out that in the first part of your career, you were a clinical psychologist specializing in relationships, addiction, marriage, and family. And this experience led you to new paths that would help people's everyday lives as well as their careers. And you embarked in executive coaching and leadership consultation for senior executives. You're also an avid writer, and you've published over 100 books, as well as lots of publications such as Huffington Post.
Not books, articles. I wish I had 100 books. No, I only have 2 books out.
Oh, sorry, two books and 100 articles. And so your #1 Amazon best-selling book is 7 Paths to Lasting Happiness. And of course, the reason why I found you was your intriguing new book entitled 7 Keys to Navigating a Crisis, which was released in May of this year. So along with your co-author with Con Apostolopoulos, I hope I got that right.
Yes, very good.
And
very good. You did get it right.
And so I'd love to chat to you a little bit more today and welcome you to this conversation. And thank you so much for taking the time to speak to me.
It's my pleasure. It's my first South African interview. So I've had a couple of them in Holland, Greece, India. So it's expanding. The message is going forward.
Absolutely. Absolutely. So my first question to you was, how did you find happiness in your own life?
You know, it's funny, people ask me that all the time because I lecture all over the world and I travel and speak on happiness and wellness. And they're like, well, how did you become a happiness expert? And the truth of the matter is this. It was on the very first day that I was born. I know this sounds crazy, but it's a true story. So I was born a long time ago in Greece, back in the day that, the only people allowed in the birthing room was my mom and the doctor. That was it. So the story was told to me growing up that when my dad shows up, he asks the nurse, there were 4 or 5 babies all wrapped up in the same generic white blanket behind a window. He says, which one is my son? And I guess at that point I had a big smile on my face. And the nurse turns to my dad and says, your son, he's the happy one. And boom, I was branded the happy one. So growing up, in my life, you're like, well, you came out of the womb happy. You've always been a happy kid. Like, that's it. So I kind of lived up to that branding. Now, interestingly enough, fast forward now 25 years. Now I'm in graduate school getting my PhD in psychology. And the professor is talking to us about nature versus nurture. In other words, how are we made? How do we become who we become? Is it our genetic predisposition or is it our environment? And of course, the truth is that both contribute, right? But I had this terrible thought. I'm like, wait a minute. What if my dad gets stuck in traffic, shows up like 15 minutes late, comes up to the same little window, asks the same nurse, which one is my son? And at that point, I'm having these terrible gas pains and my stomach hurts and I'm screaming my head off and I'm like, ah, and I'm branded, well, cranky. Well, he's the unhappy one, the cranky one. And then I'm told the rest of my life, well, you came out of the womb cranky. You were a miserable little beep, So my point to that and to the listener is this, that we've all been branded. Now, some brands are positive. And if you have a positive brand, count your blessings. For example, being the happy one, that's a great brand. And I've loved it. And I've lived it for my whole life. But there are other ones. The beautiful one, the creative one, the artistic one, the athletic one, the sweet one, the kind one, the loving one. If any of those brands, if you have those, boy, are you lucky. But having worked with thousands of people and having lectures in front of tens of thousands of people and having received their feedback, this is not, I have my own informal statistics. Unfortunately, a lot of the branding that has taken place, and again, it happens early on in our lives, are negative. And I will tell you the 3 most common and worse, oftentimes towards women, interestingly enough.
Yeah.
The ugly one, and I know this is hard to believe that anybody would call that, the fat one and the stupid one. And I know it's shocking that who would actually say that to a kid? And yet there's so many. So a few years ago, I was giving a talk in North Carolina at a women's conference, about 500 women. And I'm sharing this story basically. And I implored the audience, I'm like, look, if you don't like your brand, if you had a negative brand, today's the day to make a stand for yourself, part of your self-care, and say, I reject this brand. I'm going to change something different. Well, out of the corner of my eye, this lady stands up, starts waving her arms, kind of, threw me off a little bit. In her 70s, gray hair in her 70s, she goes, after listening to you, I'm sick and tired of, for 7 decades, I've had now in her case, she had all 3 of them. I've been called fat, stupid, and ugly my entire life. I reject that brand. And I'm like, and everybody got very quiet, like you could hear a pin drop. And I was amazed at her vulnerability and honesty to say that in front of 500 people. Like, I don't know, I would say that in front of so many people. And I said, well, ma'am, after I recovered a little bit, well, what would you like your new brand to be? And her first name was Leah. Goes, well, from now on, I want to be known as Princess Leah. And I'm like, yes, Your Majesty. And I bowed to her and everybody laughed. It became a lighthearted moment. But I used this story as an example to say, look, if a 70-year-old woman can make a decision to change her brand and live the rest of her life in viewing herself with the different lenses, then you can do it too. Anybody can do it. If you have a good brand, count your blessings. But if you don't, today's the day to do something about it and change.
I love that philosophy. Thank you for sharing it. It's so true.
If you think about it, knowledge without application is just education. We can talk about branding, but if we don't act on it, we just know more about happiness. So what? Knowing is not enough. It's what you do with the knowledge that you have. And that's how people change. And that's what I do. I transform organizations and hopefully inspire and help people to make changes in their lives now. Not 5 years from now, not 10 years from now. You have the power to change right now, regardless of your circumstances.
Absolutely. Great. Thank you for sharing. So, during the coronavirus outbreak, before we get onto your book, lots of people have had a lot of time to think, and ponder and contemplate. So what are things that you've been thinking about?
Well, honestly, the genesis of this book came as a result of COVID, because and we can dive into the 7 keys to navigating a crisis, a practical guide to emotionally dealing with pandemics and other disasters. And there are other disasters right now. There's the health issue with COVID. There's the financial crisis with so many people unemployed and desperate. Mm-hmm. And, it's the social distancing what keeps us disconnected from people. So we have multiple crises happening all at once, right? So I had a lot of speaking engagements over the summer. Guess what happened to them? Poof, disappeared. They all got canceled. And I was kind of shocked initially. But then I had this very strong prompting that, Elia, you have this time now in your hands. You need to write a book. This was the middle of March, by the way. And you need to get it out by May 1st, which is like 45 days away. Now, to put this in perspective, my first book, 7 Paths to Lasting Happiness, took me 3 years to write. I'm like, how the heck am I going to get a book out in 45 days? So I called my best friend, Con Apostolopoulos, and my writing partner. And I'm like, we need to write this book. Are you in, brother, or are you out? And without even hesitating, he goes, I'm in. And for 45 days, we redirected, basically the time that we had, we redirected our focus. And May 1st, the ebook came out, and May 10th, we got the paperback out. And now we've been doing interviews every day, podcasts, just like we're doing with yourself every day, because this message needs to get out to people. So if you have time to ponder and to think, learn a new skill, do something that you haven't done before, get outside of your comfort zone, because you're this great pause, as I call it, because humanity has paused in essence. It's a great opportunity for us to do something productive in essence.
Of course, I love it. That pause is it describes it really well. And I feel that for a lot of people, this has opened up a lot of uncertainty. They're used to that constant movement and the constant, like the next engagement, the next meeting, the next party, the next event, the next birthday. And there's just this like constant fear, like this constant wheel that's turning. And I think just stopping time for a moment has opened up a lot of uncertainty for people. And so my next question was, like, what is the correlation between uncertainty and happiness? Like, do you think that there's a link or, yeah?
No, there's a direct correlation and a heavy correlation, I think, because people, first of all, we're creatures of habit, and we like to feel like we have some control over our environment. So in the last, 2 or 3 months, the entire planet basically has been thrown off the path that we were all on. And people don't like uncertainty. They don't. It makes them feel insecure emotionally. Now with the economy shutting down for a couple of months, it makes them feel insecure financially. How am I going to provide for my family? How am I going to feed myself? How am I going to take care of my loved ones? All these things increase anxiety. At least in the United States, in the last couple of months, we've had an increase in mental health, depression, anxiety, stress-related symptomatology. Right, 700% has gone up. I'm sure that's true across the globe. I think about that. I didn't say 7% or 70%. I said 700%.
Wow.
And, the belief is that by the time this is all done, we will have 2 billion people across the globe. That's with a B, mind you, who will suffer from mental health. 2 billion people, right? These are new patients, by the way. These are not people that used to suffer from this. These are like normal people that were going about their lives, and now this tsunami of the negativity, the feelings of out of control has come up and has thrown them off. So the level of anxiety, stress, depression, suicide hotlines up 40%. Use of
Wow.
drugs, alcohol, and so on skyrocketing. So, and I know in South Africa, I think you shared with me earlier that no cigarettes and no drinking and so on, right?
Yes, correct. So yeah, can you imagine that in America?
No, well, in our state, in the state of Colorado, they tried to shut down, places where you can buy pot that you can smoke. They tried that it lasted less than 24 hours before it was reversed at the government level. Said, no, we got to leave that open because people need some kind of escape. Now, I'm not saying that doing drugs and drinking more alcohol and all that stuff is healthy for you, but people are just so stressed out. So where do they go? To the place where they used to escape in the past. They're just doing that a lot more now, which is actually exacerbating their health issues too. I mean, if you're smoking more and you have lung issues and you have COVID, that's a bad combination.
Yeah, interesting. So, I mean, it'll be 66 days of prohibition in South Africa. So no cigarettes and no alcohol.
This would never happen here. People would start a revolution in America. That's not going to work here.
Well, I mean, it's interesting. People have not been happy at all, and we're a pretty strong culture. But for some reason, it was enforced, and it's on Monday the alcohol starts again. Still no cigarettes, but it's interesting. I mean, what is your perspective on that? Like, if you were a senator or something, would you condone it or?
I mean, I think from a pure health perspective, I think South Africa did it right. I'm a big believer in free agency, that every human being has a right to choose for themselves. So when any right is taken away like that, I think I personally don't like that, and I don't agree with that. I think people need to choose for themselves what they do with their lives. I choose not to drink and I choose not to smoke, but I don't want to impose that on somebody else that wants to drink. And to me, those are fundamental freedom. So.
Yeah, absolutely. So I'd love to talk to you about your 7 keys and how they relate to healthcare workers.
Yes.
So in your book, which I downloaded off Amazon, thank you, you talk about 7 keys: self-care, awareness, flexibility, preparation, initiative, positive attitude, and kindness. So how do you think that these 7 keys apply to healthcare workers in the current, climate and with everything that's happening?
In healthcare, yes, healthcare workers are on the front lines. Yeah, I don't know if you have this in South Africa, but in America, every summertime we have wildfires, especially out in the West, and the firefighters are on the front lines, saving lives, saving property, and okay, doctors, nurses, physician assistants, anybody in the healthcare industry, and first responders, they are our modern day heroes and firefighters, basically, of this wildfire of a pandemic. Unfortunately, and this is from their own description, they're suffering from PTSD already, from the things that they have had to deal with. Because when they went to medical school or nursing school, they weren't prepared for anything like this. So they're struggling themselves, and they know that once the pandemic is over, they're going to seek some counseling because they're overwhelmed and stressed out. First of all, because they're seeing death at disproportionate numbers. I know that when you become a doctor or a nurse, you're going to be dealing with sick people, obviously, right? That's why you go to school, and that's why you get your your license and so on. And you're going to face death from time to time. You're not going to save all your patients, but not at this rate. So
No.
they have that stress. The other stress is so many of them have gotten it themselves. There are thousands of doctors and nurses that have already died because of the virus, and then tens of thousands that have been infected. And for those that have not been infected, they have the fear, what if I get it? And then I go to the hospital, I get it, I bring it home to my loved ones, and maybe somebody catches it from my own family. So they have stress both at work and at home. And there's kind of sandwich in between. So self-care, which is the first key to navigating a crisis, is so important. As a matter of fact, in the book itself, we have one chapter we talk about self-care for healthcare, like specifically for healthcare providers, because they do need to take care of themselves. So I created a personal health assessment that's in the book that asks questions, and basically on your physical health, your emotional, your mental, and your spiritual health, just to see how you're doing right now before you read the book. You know, where am I in these different areas? And that's also true for self-care, healthcare workers. So if you don't take care of yourself, basically, how are you going to take care of anybody else? That's why that's first.
Absolutely.
And then we
How
move on
did you
to
rate?
awareness. Well, I'm sorry?
How did you rate? Did you rate yourself? How did you do in
No,
the
I
test?
did. Well, here's the not great thing about the COVID, but here's a result of that. I used to walk about 3 times a week, an hour a day, 3 days a week. And it was almost like I have to do this because I'm getting older, I need to move. Now I walk every single day, not because I have to, because I want to. So I have created a new self-care habit that I never had before in my life. And I'm talking about every single day. I go out and I walk and I listen to the birds and look at the blue skies and smell the trees
Yeah.
and the flowers and so on. And I think about things. And it's been a great way to take care of myself. So I feel like I'm doing really good in self-care because I've had to do that. So then we move to awareness. And awareness really is listening, what I call with the third ear, like listen to that still small voice inside you, whether you call it your intuition, your inner wisdom. If you're a spiritual person, you can call it the voice of God, however you want to say it. The result of this book is because I listened. And that voice was very strong. And it was no doubt about it. I need to get this book out now, not next November, not in 2021. You need to get it out now. So when we listen to that still small voice, I can tell you that it will guide you. Trust it. And then act upon the message that you get, whatever that is. So listening is very, very important. And then, of course, we get to flexibility. And here's the thing. It's not that the strong will survive this pandemic or basically any other crisis. Let's not even call it COVID-19. Any crisis you have in your life, it's the flexible. And the example that I'd like to share with you is, we call it the oak tree or the palm tree. So the oak tree is this massive, huge tree. Has been there probably for 100 years, tall, huge, right? Well, if there's enough moisture, enough rain, and then enough wind, like a hurricane or something, guess what happens to oak trees? They fall and crash cars and homes and people and so on. The palm tree, on the other hand, at the peak of the storm may bend. It may come all the way down, like maybe parallel to the ground because it's flexible. But when the storm passes, the palm tree raises up again. And really, the palm tree is pretty thin. So I invoke your listeners to become palm trees, not oak trees. Don't be stubborn and say, well, this is the way I've done things, I'm going to stick to it. No, you have to be flexible and adaptable if you want to overcome a crisis and maybe even thrive during a crisis. So those are the first three keys. And then, of course, you have to prepare and you have to take initiative. And typically there are 4 personality types when facing a crisis. And I want you to think about this, where are you right now out of these 4 personality types? The first one is called the victim. And the victim is like, why is this happening to me? Like, poor me, like it's all about me. And just feeling sorry for themselves. Type number 1. Type number 2 is called the critic. And the critic basically, regardless of what the federal government or state or local government or healthcare officials say, no matter what they say, they criticize it. For example, Kim, you should wear a mask when you go outside. Well, that's stupid. Okay, well, Kim, don't wear a mask when you go outside. Well, that's stupid. Like, no matter what they say, they criticize it, right? And then we have the third group, which we like to call the bystander. And the bystander, a good person, but inundated, it's called the deer with the headlights look, inundated by fear, unable to make any choices, and just sits there and basically does nothing. Looks at the neighbors, looks to the left, looks to the right. They don't know what to do. They do nothing. And what all three of these types have in common is this: they lack initiative. None of these three types come up with any positive solutions. Now we get to the fourth type, and this fourth type is called the navigator, which is, the focus of this book. So the navigator begins, number one, with a positive attitude, which is key number 6. Have a positive attitude. We will overcome this. Rest assured that humanity may be on one knee right now, but we will overcome this. We will find the medication for this, and we will find a vaccination. And yes, we're getting beat up right now pretty badly across the world, but this is not going to be the end of humanity. We're smarter than that, and we will overcome this. So rest assured, this is, I know it's painful right now, but it will get better. So they start with a positive attitude. They do take care of themselves, so they do practice self-care because they know that they have to be and they are flexible in finding solutions. They do listen to that, inner voice, and then they prepare, and then they take initiative. They go into action. It's not just enough to prepare for something and then do nothing. Go into action. So that's what navigators do. So here's the tricky thing about this. All those 4 types that I talked about. All 4 of them exist within every one of us. You, me, and everybody else. It's just part of human nature. So was I the victim initially? You're darn right. When everything got canceled, I'm like, poor me, why is this happening to me? I was planning on traveling the world this summer, doing all that stuff, everything gone. So I kind of had the bystander look. I didn't know what to do initially. And I became the victim. And are there things that I'm critical of when I hear on television or social media? Absolutely. But the key is not to stay stuck in that position, to transition from that to a navigator. So I can be the victim for 5 or 10 minutes, but then it's time to move on. I can even be critical for half an hour, but I don't want to be stuck there all day long. I want to move on and navigate. And this is what my friend, Mr. Apostolopoulos, and I did. We navigated through this crisis. We moved from all that, and we walked the talk, basically. And we created this book. This book would not have come out if this crisis hadn't come. I had no plans to write a book this year. I mean, I had other things I was busy with, but it happened because we learned how to navigate. We took care of ourselves. We worked hard. We prepared. We did our research, and then we took initiative. And then we get to the last, which may be actually the most important one. And people say, well, why did you put kindness as a key to navigating a crisis? Why? What does that have to do with anything? It has a lot to do with it. First we started selfishly in some ways, self-care. I got to take care of myself in order to take care of other people. And so what does kindness have to do with anything? So people ask me, Dr. Elias said, am I my brother's keeper, basically? I'm already overwhelmed and stressed out on my own. Why do I need to help somebody else? And my answer is like, no, you're not your brother's keeper. You're right. You're your sister's keeper and your mother's keeper and your kid's keeper and the stranger's keeper and the homeless person and somebody in South Africa, even though you live in Colorado, because we're all connected. We're all brothers and sisters. No matter how bad your situation is, I promise you there's somebody else across the world, or maybe in your own town or in your own neighborhood even, that's worse off than you are, and they need a helping hand. And we both know, Kim, that when you help somebody else, it makes you happier. So kindness and happiness are connected. You can't have one without the other. Happy people,
Absolutely,
by their own nature, help other people, and are kind to them. But when we perform acts of kindness, it makes us happy on the inside. And basically, that's the premise of, navigating a crisis.
That's such a beautiful, I've really enjoyed your explanation. And I think it's a great sort of culmination, because the word Ubuntu, which is an African word, which means, it sort of describes a feeling of humanity and a feeling that I am because of who we are. And it's exactly that. It's showing kindness and compassion to people in your community, because one day it will come back to you in whichever shape or form. And the fact that you are only as strong as your community, and so looking after each other and looking after healthcare workers in this case with Ubuntu beds is really like, it's given us purpose and it's given us direction. And I really enjoyed reading your book. I thought it was really on point. Like lots of great examples and quirky pictures. I can see you've got a great sense of humor. So
it makes me happy, actually. I like making people laugh, honestly. When I talk, there's 2 things that when I give lectures, make people laugh and actually make them cry, because I touch their hearts in some manner, that they felt something. And as a result of that, maybe they got inspired to do something different and to help themselves and help somebody else. So that's my goal usually when I give an interview or when I talk to anybody. That's my goal. Yes, I'm very lighthearted for the most part. We are facing multiple crises all at once, and it's not an easy time for humanity, but have faith, things will get better, and we will overcome this. Maybe even if there's a second wave in the fall, that very likely it will be, we'll be better prepared next time. We were not prepared very well for this, that's for sure.
Of course. Well, thank you so much for sharing your thoughts and inspiration with me and with our listeners. I really appreciate it. And
Anytime.
I wish you all the best for your book launch. And I'll see you in South Africa when traveling is
Oh,
allowed again.
actually, I was planning, I was invited to come to South Africa. It got canceled. So it's something, it's a country that I definitely want to come. I have many good friends from South Africa. So I hope to
Wonderful.
get back sometime. Anytime you invite me, I'll come.
We will.
All right.
Thank you,
Thank
Dr.
you so
Elia.
much.
All the best.
All the best to you, Kim, too, and congratulations on your organization. Keep up the good work.
Thank
You're
you.
making a difference. You know that? That's what matters. You're making a difference. Thank you.
Absolutely. Thank you
Bet.
so much.
All right.
Cheers.